Hello, everyone, and welcome to yet another exciting episode of HT City Spotlight, your one stop destination for health and lifestyle. I'm Meghna Kriplani, the content head for healthshots.com, and today we are going to talk about gut health and cranberries. Did you know a new research shows that cranberry helps reduce infection caused by H. pylori, which is a common stomach bacteria that impacts a majority of Indians? In addition to helping the gut, cranberries also help prevent urinary tract infections, they reduce risk factors for heart disease, and they also improve immunity. So, to talk more about it, today on HT City Spotlight, we have with us Dr. Anil Arora. Dr. Arora is a gastroenterologist and a hepatologist with more than 35 years of experience. He is working with Sir Gangaram Hospital. Dr. Arora, we are delighted to have you with us today on the panel.
Thank you so much.
From the US, joining us today is Dr. Amy B. Howell. She has been engaged in research aimed at identifying the active compounds in cranberries that prevent urinary tract infections, and she's also determining their role in the maintenance of urinary tract health. Welcome to HTCD Spotlight.
Thank you for having me.
Next up is Dr. Puja Sharma. Dr. Sharma is an experienced dietitian, nutritionist, and lifestyle expert. She's associated with SeekMed, which is a global telemedicine platform that allows patients to seek medical help from the world over from eminent doctors via video consultation. Welcome, Dr. Sharma.
Hi, everyone.
Hi.
We are also joined by Sumit Saran, who is the India representative from US Cranberry Marketing Committee. Thank you for joining us.
Thank you.
So my first question is to you, Sumit. What exactly is your role as the representative of US Cranberry Marketing Committee?
Well, actually, we are a consulting firm, so we represent the growers and processors of cranberries from the US in India. So we don't buy or sell ourselves. Our role is to create market demand for cranberries by creating more awareness about its health, nutrition, and of course, the taste that these berries have. And so we work with the expert panel that you see today on our frame. These are the kind of people that we will work with, Indian experts, who will then talk to Indian consumers and take it forward from there.
Okay. All right. Moving on to Dr. Arora. From you, doctor, I'd like to know what is the situation with gut health in India and what exactly is H. pylori?
You see, H. Helicobacter pylori is a gram-negative bacilli which was discovered by, you'll be surprised to know, by a medical student and a fellow called Warren and Marshall from Australia way back in 1982. In fact, prior to that, everybody on the earth believes that ulcer is because of acid and acid is because of the ulcer. It was a two-way relationship. But thanks to discovery of this new bacteria, which is partly aerophilic called Helicobacter pylori, the word of peptic ulcer management has made a drastic sea change. And if you eradicate H. pylori, you are able to cure the peptic ulcer disease, something which earlier there was an acronym called once an ulcer, always an ulcer. There has been a paradigm shift in the way we look at peptic ulcer disease and try to treat it. But only problem with Helicobacter pylori is the ubiquitous infection. In my practice, almost everybody who comes to you for endoscopy will have an H. pylori. So we still are not certain how much does it contribute to various illnesses in the body. A lot of basic research needs to be done. But fact is, it is one of the most common organisms found in the Indian territory.
Oh. So, Dr. Sharma, if I can ask you something, since you're a wellness consultant and dietitian, in your experience with gut health of people who come to you for consultation, what is the situation with H. pylori?
The H. pylori is a very common type of bacteria that grows in a digestive tract, and it has tendency to attack the stomach lining, right? So H. pylori infections are responsible for majority of ulcers in the stomach and the small intestine. These bacteria are adapted to live in a very harsh acidic environment of the stomach, and these bacteria can change the environment around them, and they can reduce its acidity so that they can survive. Now they have a spiral shape the pylori allows them to penetrate your stomach linings where they are protected by the mucus, and also your body immune cells are not able to reach them. So this way, the bacteria can interfere with your immune response also and ensure that they are not destroyed. And this can lead to a certain stomach problem. While if you see the infection with this strain of bacteria doesn't cause any symptoms, but it can lead to diseases in some people, which can be peptic ulcer or a gastritis or an acidity. So people who come to me, they mainly are concerned about these problems, but they never relate this with the H. pylori. And the base is that if the bacteria is there and the acidic environment of the stomach is changed, so obviously the people will face problem with this bacteria in terms of ulcers and gastritis.
Okay. All right. If I could ask you a question, Dr. Amy, now you're an expert on the health benefits of cranberries. We understand that a major study was just completed on cranberry consumption and its role in suppressing H. pylori bacterial infections. Can you please tell us a little bit more about this?
Yes, this is a very recent study, very well conducted in a very high top tier journal, worldwide journal, and it had over 500 people that were H. pylori positive when they started the trial, and they were given different doses of cranberry that contained what the active compound called proanthocyanidins or PACs, and they did it either once a day or twice a day, and they found that after 8 weeks, the 20% reduction in the H. pylori incidence in these groups, and that was with taking 1 glass of cranberry in the morning and 1 glass of juice at night, 8-week period, and it needed to contain about 44 milligrams of this proanthocyanidin. And you can get that if you look for a juice that has either 35% cranberry, or sometimes you can find 100% cranberry juice that you can dilute out with juices, mix it into foods. It's quite astringent, but there are ways to consume it and get the health benefit. So the great thing about this is if you reduce the incidence of the disease within a population by 20%, that's fewer people that could progress to ulcers and eventually stomach cancer, because you have a 3 to 6-fold increased risk of developing stomach cancer with an untreated ulcer. So you can reduce the level of antibiotics that are used within the population as well. And that, of course, in India is a tremendous problem that needs to be addressed.
Okay. Dr. Arora, what is your take on this research, and how relevant or how useful this is for Indians according to you?
You see, this research has been done in US, and where the incidence of the H. pylori is far less than what we see in India. That is the first thing. Secondly, it is by default a disease of poor hygienic conditions because it spreads by the fecal-oral route. If you look at the prevalence of H. pylori, it is variable from 20% in general population to 80% of the general population, depending on which strata of the economy do you live in. So in developing poor country like ours, we have a high prevalence which goes anywhere from 60 to 80%. So since the basic concept of poor hygiene, lack of availability of good drinking water or proper, disposal of the human excreta, these are the moot points which will take away of the infection. If you look at even at the evolution of the disease, tends to go down in terms of incidence. The moment you improve your basic hygiene, the moment you tend to go up in your ladder of your economy, and the moment you tend to become a developed country. So how much will that be contributed by cranberry? So certainly it is a welcome relief. If you can have something which decreases the incidence over and above your municipal efforts or your efforts to have a good potable water, this is a welcome relief. But the problem lies in the basic supply, which will prevent you from so many other diseases also.
Okay. Uh, Dr. Sharma, what's your take on gut health and cranberries?
Pylori bacterial infection is a worldwide concern now, and due to its high global preference rate, which is over 80% in some developing countries, and that's a potential cause to stomach ulcers, which, when untreated, increase the risk of developing stomach cancers as well. So there are phytochemicals which are contained in the cranberries, which play a very important role in the digestive health. Now, cranberries are very high in antioxidants. A study has found that out of 20 common fruits, cranberries have a highest level of phenols, and it is a kind of an antioxidant. Various research and results have suggested that proper cannabis consumption for 8 weeks at least induces the sustainable changes in the gut bacteria health and ulcers also. So while when you talk about cranberries, the selection of cranberries is very important to understand that even if you are consuming a juice, in the
Yeah.
market that is available, it should not be with a high sugar content. And if you see the concentrate, it is just 1% of cranberry concentrate. While if you are want to improve your gut health, then you have to go with a 20% concentrate of cranberry and with less sugar, obviously. So the same compound, the antioxidant in cranberries, helps to protect the heart also. It improves your digestive system function as well. And there was a research in 2016 also, which was published in the research in pharmacy practice, that this cranberries can prevent H. pylori from growing and multiplying in the stomach lining. So obviously the cranberries are too good. And also, if you say about the acidic content of cranberry, it is so high, it is very highly acidic that it actually gives favorable condition to the stomach as well, being acid.
Okay. Now that we're talking about the market and the kind of cranberry rated products that are available there, what I would really like to ask you, Sumit, is that what's the Indian market like when it comes to cranberries, and how can I buy the product here?
That's a good question. So Indian market is a very new market. It's a growth market. Only in the last 2, 3 years, people are beginning to understand and get aware about cranberries and its health benefit. A lot of doctors in the past actually talked about cranberries and its benefit for urinary tract infection. It's only recently that this research on H. pylori broke through. So it's been growing very, very fast. We, as the marketing representative, we work with importers, wholesalers, retailers, and try and get cranberries to as many platforms as we can. And so today, US Cranberries is available with all major dry fruit retailers. What we have also done is made sure that it's also available on all e-commerce platforms. And now there are e-commerce platforms in India that are delivering to 90% plus PIN codes. So all you have to do is log on to any of the platforms that you shop on and look for US Cranberries, and you will be able to find it and get it delivered to at least 90% of India.
That's amazing.
And also, I mean, compared to a lot of other nuts and dry fruits, it's not expensive. So it also is very, very affordable on the pocket.
Okay. We've been talking a lot about UTIs and cranberries and gut health and cranberries. What are some of the other health benefits, Dr. Amy, that cranberries can help us with or give us?
Well, talking about urinary tract infections, it's very interesting because these proanthocyanidins or PACs that I spoke about before are really the star of the show when it comes to cranberries.
Okay.
An activity that they prevent bacteria in the body from sticking to cellular surfaces, and bacteria have to stick to cells in order to grow and multiply. So this is the case with H. pylori in the stomach, is that these proanthocyanidins prevent the H. pylori bacteria from sticking to the stomach lining or the mucin and boring in and sticking to the underlying epithelial layers. So prevents the infection from progressing. And the same goes for the urinary tract, is that these compounds prevent the E. coli bacteria in your bladder from sticking to the bladder wall. And if they can't stick, they don't cause an infection. We also see this happening in the oral cavity. These are extracts of packs from cranberry that are made into oral rinses and gums, which prevent plaque bacteria from sticking to teeth. Other health benefits that are being heavily researched now are ones that are seeing reductions in risk factors for heart disease. This includes improving the flexibility of arteries, lowering the oxidation of bad cholesterol, which makes it more dangerous, and reducing inflammation in our arteries. So when our arteries become clogged and they're reduced amount of area for the blood to flow through, we can get cognitive declines. We can't think as well. We're not getting enough oxygen to our brain. We can get heart attack, strokes, things like that, as well as physical disabilities. It's harder to take a walk down the street when you're not getting enough oxygen through the bloodstream. So having cranberries will really help to keep your arteries nice and flexible to allow the life-giving oxygen to go through your body. So it's very exciting when we think about a food like cranberry that has these multiple health benefits without having to resort to killing off these bacteria. Because when you kill bacteria, you're acting like an antibiotic, and that's not what cranberry does. Cranberry actually prevents steps in these infection processes. So you're preventing the infection in a very natural way, which can be complementary to antibiotic use, but it doesn't replace it. So if you do get these types of infections and it progresses to disease like urinary tract infections and H. pylori, you do need to go see the doctor and go through a round of antibiotic treatment. But on a daily basis, taking this cranberry can help in numerous ways.
Okay. Dr. Sharma, what's your take on UTIs and cranberries, and what is the situation when it comes to UTIs, in India? What's the whole scenario there like?
UTI in India, especially with the women, it is very bad because of the unhygienic conditions, as you know. And cranberries, it is a creeping shrub. It is a wine which is loaded with vitamin C, fiber, rich in phytonutrients, and which are essential for all the round wellness. And it also contains a special chemical substances that may offer protection from tooth cavities also, apart from urinary tract infection and inflammatory disease as well. The high level of proanthocyanidins in cranberries helps to lower the adhesion of certain bacteria to the urinary tract walls, and in turn, it helps the fight of the infections basically. So cranberry juice helps to lower the urinary tract infection too. The prevalence in India is very high of the pregnant women in India, which is reported from 3 to 24%. And also, like, if you see the asymptomatic and no symptomatic cases are also there of urinary tract infections. People have urinary tract infection, but they don't realize that, and then they go for high and heavy dose of antibiotics. And I've seen a number of cases, the moment they go for cranberry juice of 20% concentrate, it improves after 4 or 5 days. It starts improving without any kind of antibiotics, without any kind of medications, just drinking a lot of water in the whole day and a cranberry juice, which is like 100 ml or 200 ml. So that really, really helps in the urinary tract infection.
Okay. So Dr. Amy was also talking about heart health. So my question to you, Dr. Puja, here is that our gut is also related to our heart. So how can, cranberries help there? And while we are talking about this, do you think cranberry juice can also help?
See, the cranberry juice is the 20% concentrate. The concentration of cranberry juice is very, very important. If it is only 1% cranberry, then it won't help. But if it is a 20% or more than 20% of concentrate, if it is to 50% also, that will definitely help the heart health, right? And it should not be only cranberries, it should be physical activity as well, kind of a full dietary analysis and the change in the diet. But yes, cranberries definitely helps to increase the HDL level. which is very good for heart also. And when you eat cranberries, that also really helps. Instead of juice, if you go with the full cranberries, because it is an ample amount of fiber is there in the cranberries. So if you have cranberries as such also, that also really helps in the heart health and increases the good cholesterol level.
Okay. So, Sumit, if I could ask you this, which cranberry juice do you think our audiences should buy, and why aren't fresh cranberries, as easily available in India as dried ones?
Yeah, because
So
first of
we
all,
actually
cranberry,
we actually represent the US Cranberry Marketing Committee, so I can't talk about brands.
Mm-hmm.
Uh, we are a generic marketing, but if you do a little bit of research on any of these platforms and then look at the back of the pack, you will be able to easily find brands that will give
Mm-hmm.
you 20% or more cranberries. Why is it not available fresh? Is because it's harvested in autumn or fall in the US, and it's a very short period that fresh cranberries are in the market. But you can, of course, freeze dry them and store it for over a year, or you can make juice, etc., out of it. So the most common, and fresh cranberries are not imported in India. So the most common way cranberries are consumed in India are actually like this, which are which are dried cranberries, and almost has the same benefit of a fresh cranberry.
Okay. Um, Dr. Arora, if I could ask you a question now.
Yes.
Can a person with high blood pressure eat cranberries on a regular basis?
See, you should understand, first of all, why does the hypertension occur?
Hmm.
This is by default a disease entity called essential hypertension. Then we do not know the cause.
Hmm.
It may be related to stress, it may be related to the drugs, it may be related to the genetics, it may be related to increased rigidity and decreased elasticity of the arteries.
Hmm.
So not everything will be undone by cranberries. Let's be very clear about it. But the very fact that there is some relationship between the large number of the bacteria which are residing by default in the gut. And let me remind the audience that the number of the bacteria and the genes which these bacteria have is almost 50 times more than the human genome. There are trillions of the bacteria lying in the gut, and our understanding of the relationship of the gut microbiota with the human diseases, which most of the speakers have been referring to, is very minuscule. So why should there be trillion bacteria be lying in the gut doing nothing? Are they of any use to us, or they are a liability? We do not know. Possibly they are both. And if they are a liability, then obviously anything like cranberry, which can, even if they are lying, if it can prevent the adhesions, as Dr. Amy said, if they can prevent the adhesions to epithelial wall in the urinary tract or epithelial wall in the colon or in the stomach, then even if they are lying down, let them lie down innocently and in a virgin manner. But the problem is, at some point of time, they do tend to invade the invade the basic defenses of the human body in the form of, internal lining of the stomach, of the arterial wall, of the urinary tract. That is what gives the problem. I wish we could get rid of this bacteria and have new human beings which do not have trillions of the bacteria. So it is a symbiotic relationship between the two. So it's not easy to say that if you take cranberries, you can start smoking, so you can have stress, you can take drugs, it will increase blood pressure, still you will not get hypertension.
Okay.
I
All
think
right. So,
hypertension
yeah.
is more related with more of stress levels, the kind of life you are, leading, your anxiety levels. So hypertension is more
Hmm.
related to those kind of things, and it can be controlled over only by lifestyle changes.
But it shouldn't give you a false impression that just because you are sipping in a juice of cranberry,
This
you are away from all the diseases. So far as you understand the basic science behind it, I'm happy to companies who are
Yeah.
doing good research on cranberries. I'm badly looking forward and sincerely looking forward to anything and everything which gets rid of the bacteria in the gut. What are they doing? They're lying in billions. And in fact, there are so many other diseases, including Alzheimer's disease, Parkinson's disease, coronary artery disease, which have all been linked to the gut microbiota. But the microbiota is so complex, so diverse. It's very, very difficult difficult to put a causal relationship between the bacteria and say coronary artery disease or hypertension. I think we are in the too primitive stage of understanding the microbiota of the gut, realizing very well this is something you cannot just wish away. You have to live with it, and you must learn to live with it.
So let's talk about something that is very pertinent to the times we live in, which is that we're in the middle of COVID-19 pandemic, and immunity has been a concern for everyone. So, Dr. Amy, what I'd like to know is that what nutrients do cranberries possess that help in building immunity?
Well, cranberry has a wide array of what we call phytochemicals or plant chemicals that go beyond basic nutrition. So basic components would be proteins, carbohydrates, that kind of thing. These what we call nutraceutical that have some benefit beyond basic nutrition are these proanthocyanidins, the anthocyanin pigments, which give cranberries their beautiful red color, as well as the flavonols, which can attract pollinators to flowers, that kind of thing. All of these have these antioxidant potential. And we're basically, our lifestyle factors greatly contribute to our oxidant status in our bodies. So if we have a poor lifestyle, we make poor lifestyle choices. If we smoke cigarettes, if we're exposed to the sun too much, if there's excess air pollution, and I know India, I've been there many times, and there is quite an issue with that in many of the cities. If you're already ill with something like diabetes, your body is producing a lot of these oxidants, which are like little bullets running through your bloodstream looking to bind in various parts of our bodies and cause damage. So the interesting thing is that cranberry is very high in antioxidants. So as you get older, especially, our bodies reduce their ability to produce these natural antioxidants. So we have to supplement with foods that have high levels of antioxidants, and cranberries are a great choice. They boost up our immune system and allow us to help to resist infection by viruses, bacteria, and actually fungi as well. So it's very interesting if we can prevent diseases and afflictions, especially as we age, by using good diet and having cranberries and other berries and fruits and vegetables in our diet on a daily basis. We really can give our body, our immune system a boost and allow it to protect us from some of these things.
Cranberries are also touted as anti-inflammatory in nature. What does this mean exactly, and how can our viewers make sense of this?
Well, as the doctor explained, our guts are very important in maintaining our overall health. And interestingly, a lot of the phytochemicals in cranberry, of course, when you consume juice or the dried cranberries or a supplement product containing cranberries, it goes into our gut and will dissolve and go through secondary metabolism and interact with our gut microbiome. And the research has shown that some of the antioxidant and anti-inflammatory potential is occurring in the gut, in that these compounds, especially the proanthocyanidins, are favorably impacting our microbiome, or our good bacteria that are in our guts, that improve our overall health. And another very, very good, if you want to call it, side effect of consuming cranberries for the gut is that research is showing that the proanthocyanidins actually help the gut lining to heal itself. There's the syndrome called Leaky Gut Syndrome, where these junctions open and close and keep the nutrients and things in our stomach lining and our gut from entering our body. But when these junctions open, some things can leak in and cause an inflammatory response and an immune response in our bodies. So cranberry actually helps to keep our stomach lining healthy. And that's extremely important when you're trying to prevent illnesses and have overall good health.
Okay. Dr. Sharma, if I can ask a question to you. Do you think women can safely?
I can't hear you. Please repeat it again.
So pregnant women can consume cranberries safely?
Yeah. In fact, they should consume cranberries because they are at the higher risk of having urinary tract infection. You know, and as
Okay.
said by doctors, it is a very high antioxidant and an anti-inflammatory compound which is present in
Mm-hmm.
cranberries. So any kind of inflammation in the body, the cranberries will definitely help, and the pregnant woman will have a less chances of getting urinary tract infection. So the cranberries has like 80% water and 10% carbohydrates. And other
Mm-hmm.
than that, it has flavonoids, anthocyanins, catechin, organic acids, and a small amount of ascorbic acid also, which really helps pregnant women to develop the immunity and to provide the maximum antioxidant level.
Okay. Also, earlier we were talking about how cranberries are a little acidic. So I have a follow-up question for that, which is that what if you are somebody who already has acidity issues? At that point, do you think it's okay to have cranberries? How can you consume cranberries then?
Yeah, so see, the single strength cranberry juice is not applied to the people who have high acidic levels.
Mm-hmm.
They Cranberry have a
Okay.
pH of less than 2.5, which is very, very acidic. But for the gut health,
Okay.
that acidic environment is very important for the stomach gut health, right? And that's what H. pylori does. It just neutralizes the stomach acidity and makes it more alkaline. That's the reason we are having more problems. So they can consume cranberries, but it has to be consumed in a very less strength, like a fistful of
Okay.
cranberries or a concentrate of 20% cranberry juice. That's perfectly fine. They should not go with the single strength juice of cranberry because that will be very, very acidic.
Okay. All right.
Yeah, so what you can do is you can make a cranberry juice cocktail, which is a mixture of cranberry juice, some sweetener, some water added to it, and they can take a cranberries, a fistful of cranberries. Even they can take a cranberry capsules, which are now available in the market. Though I don't recommend anything which is processed, but if they really
Yeah.
want to have cranberries, they can have capsules also, which will not cause any kind of acidity.
Now that we're in the middle of the Indian winter, and it's also the season for the flu and infection, and we know that cranberries can help boost the immunity. Do you think it's one of those foods that people should eat if they're down with the cold and cough?
Yeah, so not only cranberries, any kind of fruit really helps in developing immunity because winter is the season where all the kind of new vegetables are available, different colors of vegetables, different fruits in the market. So, but yes, cranberries also helps to improve the immunity levels, as reported earlier, that cranberry definitely helps in the improvement of the immunity. And it you can add into your cookies or you can make biscuits out of it, just add it in your salad. You can make a instead of having a normal ketchup from the market, you can just prepare a ketchup out of tomatoes and cranberries at home. That's really nice. You can add up in your morning cereal also. You can actually do a lot of things with cranberries. You can add in your puddings also. You can add in your oatmeal also. Lot of things you can do. You can add in your halwas also, your laddus also. There are many things you can add, but yes, it definitely helps to increase the immunity levels along with other foods which are available in the winters.
Sumit, if I could ask you this question, for all our listeners who might want to now go ahead and buy cranberries, wherever they buy it from, what is your suggestion to them? What should they keep in mind before buying either cranberry or cranberry related products?
No, I think if they do a little bit of research and look at the back of the pack, there are brands that are with sugar, there are brands that are with less sugar, there are brands that are only 1% cranberry in the juice, there are brands that are 20% plus cranberry in the juice. So there are plenty available. And with the e-commerce platforms now allowing people more ease to read and research, It's very easy. I I I will leave it to the consumers to judge it for themselves, but they can choose whatever they like, and there are all kinds of options available.
Okay. Dr. Amy, my next question is for you. We've spoken about UTIs and such, but I'm sure this must have sort of left the room open for questions like, are cranberries only beneficial for women? What do you think about this?
Well, actually, no. Men as well can get urinary tract infections, especially as they age, because the
Okay.
infections come from their prostate and they get it through the bloodstream. So we see that young girls and that are going through their menses, as well as pregnant women, are very susceptible to UTIs, and college age women as well are very susceptible. But again, as people get older, the men begin to start getting infections. And interestingly, studies have been done that show that urinary tract infections can actually be the reason that men pass away in long-term care facilities. So it's interesting to note that and keep that in mind, that it's not just for women.
Okay. All right. As we, draw to a close to this very insightful session, I would request all of you to just share your thoughts about, everything that we've discussed, starting with you, Dr. Sharma. What do you think, what's the takeaway you would like our listeners to go home with?
Yeah, I think cranberries are definitely very rich in various healthy vitamins, rich in antioxidants, rich in phytochemicals, and it is a member of a family of blueberries and, other kind of berries also. But cranberries, as such, the juice of cranberries is very, very healthy. You can always have it. A fistful of cranberries every day will improve your immunity, will help you to improve your gut health also. Even the juice will keep you away from all the urinary bladder infections as well. So I would recommend you to please include cranberries on a daily basis. You can
Hmm.
include as a like dried cranberries or in the juice form, whatever way you like, but try to just include that.
Okay. Dr. Arora, if you could just share your thoughts with us. Dr. Arora, we can't hear you.
I'm so happy that some company is trying to do a basic research on the interaction between the various polyphenols and various anthocyanins which are being available as antioxidants in these compounds, which is easily available and which has a potential benefit for so many illnesses starting from the gut. Gut, in fact, is the brain of the body, which lets so many bacteria just transgress the normal immune system and try to evoke some number of diseases, including coronary artery disease, neurological illnesses. But the basic research is still at the very infancy. So I look forward to have, you know, effect of single. What we try to see using cranberry juice is we just see it through the prismatic vision of one agent giving you a benefit of, say, relief in hypertension or relief in H. pylori infection. But the human body interacts in a very complex manner. The stress of the body, hormonal levels, the dietary components. I'm sure Dr. Puja would agree.
Yeah.
Major component of the bacteria-related problems is related to the diet. If you take a diet which is very conducive to the bacteria lying in the large gut, so many anti-inflammatory pro-oxidant states might change. So we do not know what is the component of contribution from, say, gut diet, the bacteria, the stress, the hormonal changes, and the lifestyle changes. I think a basic research on individual components will be a welcome relief. I'm sure we'll like to get most of the diseases which stem from the gut. And this is a welcome research product from Cranberries. And if they can give us more data on the individual component, I'm sure they can do the research in other components as well. So we'll be happy to have it as our nutraceuticals, as you very rightly said.
Dr. Amy, what would be your last words in this session for our audience?
Well, I would say that given the worldwide incidence of bacterial infections, urinary tract infections, and especially H. pylori, which is considered by the World Health Organization to be a class 1 carcinogen, we are faced with a crushing amount of antibiotic resistance to treat these infections. And we have to employ complementary and alternative strategies to manage these infections. As I said before, a cranberry is not a substitute for antibiotics, but it can be a complementary approach to managing infections. What we want to do is try to reduce antibiotic use overall in the world to save the antibiotics for when we really need them. And cranberry can be used as a dietary approach on a daily basis to allow people to get multiple health benefits to improve not only their immunity, their inflammation status, but also prevent bacterial adhesion in their bodies, these pathogenic organisms, and prevent a step in the infection process in a natural way. And people like to manage their own health. Consumers don't want to wait till they get sick and have to go to the doctor and get a heavy-duty drug or pharmaceutical product. So if we can do this and prevent infections, it's so much better for our health, as well as preserving antibiotics for when we need them the most.
Okay. So Sumit, your take on everything today.
No, it was so enlightening for me to hear for Dr. Arora, Dr. Chopra, and Amy and I have been talking on this. I just wanted to say that after all, it's a beautiful food. So it's not a medicine, or we're not looking at it as an antibiotic replacement or anything. अच्छा भला dried berry है, खाइए, enjoy करिए. It's also extremely tasty.
Yeah.
You can consume it in any way you like. US Cranberries India has a website. We have an Instagram page. Thousands of recipes are there done by Indian chefs. So from absolutely ethnic Indian to extremely exotic Western, you can create whatever you like. And it's now available, at least we believe we can get it to across 90% pin codes in India. So बस खाइए, enjoy करिए इसमें. It's not that serious.
Okay.
Yeah.
So this is truly a very, very insightful session. I'm sure that everyone who's been watching, this session with HT Series Spotlight must have learned something new about cranberries. Very special thank you to US Cranberry, and a special thank you to Dr. Amy Howell, who's joined us from the US. Dr. Anil Arora. I think he's having some tech issues, but even his inputs were extremely, extremely, insightful and interesting. Dr. Sharma, thank you for sharing such exciting information about, US Cranberry with us.
Thanks.
For having us.
Thank you so much.
Yeah.
Thank you.